Hello all, welcome back to the MOOC course on oral biopsies. The biopsy complications and management in the course of oral biopsies address the potential complications that may arise during or after biopsy procedures and provides guidance on how to recognize and manage these complications effectively. This module is essential to ensure patient safety, minimize risks, and enhance the overall success of oral biopsies. Here is the detail of this module. So, what are the common complications of oral biopsy? Complications of oral biopsy can be broadly classified under three headings. The first and the foremost one is what we call as the bleeding. The next is a potential source of infection, and the third one is a little more dangerous one, which is the nerve damage. So let us understand what is bleeding. Bleeding is profuse flow of the blood from the wound or from the suture. So basically, identifying the bleeding is most important. Recognizing and assessing the severity of the bleeding after or during the biopsy is very important for a surgeon or a biopsy person to identify. Next, what are the causes? Understanding various factors that contribute to the bleeding include vascular involvement and procedural aspects. So, how do we manage? Implementing appropriate hemostatic measures such as direct pressure, or you can also use other hemostatic agents, or even providing suture to control and managing bleeding. So, ultimate goal of a dentist or a surgeon is to manage the bleeding. So, next is infection. So, risk of infection is increased post biopsy, including pre-existing conditions and compromised immune status. For example, a diabetic patient is in more risk of uh, contracting an infection compared to a normal person. Even patients with immune compromised conditions like HIV/AIDS or organ donors can also have increased risk of post biopsy infections. So, how do we prevent it? So, the prevention is basically emphasized on use of sterile techniques and also prophylactic antibiotics. So, management, so addressing infection through proper diagnosis, prescription of antibiotics, and appropriate wound care is at most important for management of infection. Next, we'll understand about nerve damage. So the first and the foremost important thing is to identify or recognition of the nerve damage. So we'll have to understand the signs and symptoms indicative of potential nerve damage following an oral biopsy. Next, paresthesia is one of the important feature what you can identify. So paresthesia is basically altered sensation. Typical tingling or prickling sensation can be dealt by the patient. So hyperesthesia is another thing which can be seen. It is basically diminished capacity of physical sensation for the patient. Next, hyperesthesia can usually reported in the lower lip biopsies, and it is seen in 1 to 6% of all cases. Next is prevention. Prevention of nerve damage is usually done by minimizing the risk and including careful planning and precise execution of biopsy procedure. So the management includes implementing strategies to manage neuropathic pain and collaborating with specialists for long-term solutions. Next, we'll learn about postoperative complications. What are postoperative complications? By definition, postoperative complication refer to adverse effect events that occur after completion of an oral biopsy procedure. So the timeline is like these complications may manifest immediately after the biopsy or in days or weeks following the procedure. So what are the postoperative complications commonly seen? The first one is delayed bleeding, infection control, neuropathic pain, and scar formation. So delayed in bleeding, infection control, and neuropathic pain have already been discussed. So what are the management strategies? So timely intervention is very important, emphasizing the importance of promptly addressing any identified postoperative complication to prevent further complication and discomfort for the patient. Next, pharmacological management is again very important. Use of antibiotics, analgesics, or hemostatic agents can be prescribed. Next, the follow-up care. Again, we have to ensure a proper structured follow-up plan to monitor and assess the resolution of postoperative complication and ensure optimal wound healing. Next, we'll learn about the patient education. So patient education is also very important, and it includes communication with the patient. Emphasizing the importance of clear communication with the patient is very important regarding post complications and their likelihood and the steps to mitigate these risks. An informed consent always has to be taken, ensuring that the patient are well informed about the possibility of a complication and actively participating in the decision making process. Next is the documentation and reporting of these complications. It is very important, highlighting the importance of this accuracy and detailed documentation of the complication for medical legal purposes is very important, and continuous improvement in patient care. Recording is always a guideline of how systematically it is recorded complications, and their management and follow-up procedures need to be done. So reporting complications, the stress of importance to the documentation, and any complication and adverse events that occur during and after biopsy procedures have to be documented and reported. So this summarizes the whole module, and thank you very much for your patient listening.